Hello and welcome to this video presentation. I'm Maria Alexandrou, a local councillor in Enfield, North London, and one of the organisers of the conference we held on cervical cancer awareness during Cervical Cancer Awareness Week. All the presentations were full of important information, support and advice about cervical cancer, so we have now made them available as several standalone videos. Here we have the second presentation from that conference by Dr Nitu, who's a senior consultant gynaecologist based in London. Nitu spoke about cervical itself and what steps we can take to prevent it, including lifestyle changes.
This talk is a little bit longer because I'm going to try and get lifestyle in because I think it's important for all of us. And all this information is on my website, which it comes up on every slide. You don't need to take notes. And within the week, I'm expecting that this talk will also be on my website under teaching materials. So I'm going to share my screen. So we talked about the fact that it is preventable cancer. It occurs in young people. Human papillomavirus is the cause of the cancer and precancer, and that with sexual health education at all stages, along with adopting safer sex, as well as avoiding alcohol and smoking and using condoms and dental dams if you're having oral sex, and availing of the vaccine as hopefully at the age of 12 or 13, but it doesn't matter even if you're late for it. It's available until age of 25. And up to the age of 50, where you would have to pay for it yourself, although there are some situations where there may be exceptions, like in some transgender people, as well as in men who have sex with men. It's important to understand that human papillomavirus doesn't just cause cervical cancer, it's also the cause for vaginal and vulval cancers, as well as in men, head and neck cancers and cancer of the penis. So now I'll be talking a little bit about precancer and cervical cancer. And it's important to understand that there are a lot of benefits from cervical screening. For every 100 women who have screening, this is a slightly old slide, but basically 4 women will end up coming to my clinic to have a colposcopy, where I would have a closer look at the neck of the womb. The vast majority would be reassured, but this is what will actually help us to prevent and lower the death rates, because we try and pick this abnormalities early. So we have primary HPV testing. So you would go to your GP and you would have a test, which would, just like a smear test, it's the same, but we would test it for whether you're positive remember those high risk numbers, there are 12 of those strains. We check whether you're positive for it. 16 and 18 cause 70% of the cervical cancers. And if you're positive for it, that's when, depending on your age and other things, you will be then referred for a colposcopy and further testing, maybe earlier smear tests and things like that. So it's really important. The vast majority of women will clear HPV naturally within a couple of years. Sometimes it may lurk in your system to no problems, causing no problems at all, but you will go back onto the screening system where you will have it every 3 years until you're about 49, then every 5 years until you're 64. So the goal of treatment is really to prevent cancer and to avoid overtreatment. I often get mothers and patients who will say, why don't you just take it out? Why don't you just cut it out? It doesn't work like that. Most changes will go back to being normal, but some women will need treatment. And if you overtreat people, you will not only cause more complications, but also more anxiety. So it's really important to understand the flow chart. You start with having primary HPV testing. Hopefully you'd have had the vaccine in school. And then you have primary HPV testing where you'd have a smear test like I've shown over here. You have a little instrument that goes inside, exposes the cervix, and a smear is taken. And hopefully, because we saw that women and people with the cervix often can be hesitant to come because of a previous bad experience, that self-testing, which is now being trialed, may be the future, so that we can pick up women with high-risk HPV and manage them earlier rather than later. Because just missing your appointments means that you have a longer chance for the virus to create mischief. So if one is then positive to those 12 strains of high-risk HPV, then the cytologist will have a look at the cells which have been shed in the smear. Previously, that's what we used to do. And it was not as accurate as doing the primary HPV testing, because when you have a human being looking at a slide, they don't get it as accurate 100% of the time as HPV testing, which is a computerized test. So if you're positive to high risk HPV, it then goes on to be tested under the microscope. And then based on those findings, you would then be referred to somebody like me to come and have a colposcopy and, if needed, treatment. But the management goal is to prevent cancer and to avoid overtreatment. And so when you go to your nurse or your doctor, they would insert this instrument, they would take a smear test, and then that would get centrifuged to be tested for human papilloma virus. And if you test positive to high risk HPV, then the cytologist will look at it on a slide, having spread it on a slide, and see whether you have normal looking cells, where you have lovely little beautiful nuclei. Then when the center part of the cell starts getting bigger, it's known as mild changes. And then they get more funny in shape, and it's known as moderate changes. And then the center part of the cell, called the nucleus, has occupied most of it, where it's known as severe changes or high grade changes. And sometimes you can see frank cancer. That's not common. Only a couple of times in a year will I see somebody referred with frank cervical cancer, which is so good. We want to catch people before they actually reach that stage. So smear tests are not to diagnose cancer, they're really to diagnose pre-cancer. And so when you get referred to somebody like me for a colposcopy, what I do is you would lie in a couch, which is quite nice actually, because it has, you can watch on the screen, and you can be as comfortable with your head up or down. And the person looks down the magnifying instrument called the colposcope, which doesn't go in. It's not a painful procedure, but it's a slightly undignified procedure, like a smear test. It's slightly uncomfortable. And that's important to reassure people when they come for a colposcopy. And we send a leaflet out before. And so this is the setup in Barnet. We use a solution called acetic acid and iodine. These show up cells that may need to have a biopsy. So this is where you can see some changes. The rapid uptake of white changes. And so I would take a biopsy from a couple of places to see whether this person would need treatment. And so people who get referred for colposcopy are those who have had an abnormal smear because you've tested positive for high-risk HPV. Then you had the cytologist look at the smear and say, yes, I can see changes which are moderate or severe changes. And so they get referred to me, to the special clinic. You may have a nurse specialist, you may have a doctor. And if there's a suspicion of cancer, so somebody like the nurse who was talking in the video, or Dr. Claire Stevens, would look at somebody's cervix and think, oh, this doesn't look very healthy, and I would like a specialist to look at it. If there's somebody who's having bleeding persistently after sex and you've done everything else, then they would need a colposcopy. Sometimes after treatment, we would have to have a look. If you have had repeated smears that don't read and don't give us enough cells and don't tell us whether you're positive, it can be because of a lot of discharge, or it could be because there's something more serious, then you would get referred for a colposcopy. And of course, if there are polyps and things like that, or if you're worried about something, then, and you're confused, in those situations, some women may need a colposcopy. So when I look at this, the neck of the womb, the cervix at close, it may be completely normal, as it is in most patients. In some women, there may be mild changes, and in some there will be quick uptake, and you can see these sort of cobblestone appearance, and we have to take a biopsy. And very rarely you can see that the cells have broken through and are causing a lesion. I used to see a lot of cervical cancer. I did a lot of radical hysterectomies in young women, sadly, who had cancer at 20, 25, 30 in India. So, I've got a long background of having dealt with patients in this situation. But fortunately in the UK, we have about 8 women being diagnosed with cervical cancer every day, which is still too high. And so we want to lower that. And so this condition is known as cervical intraepithelial neoplasia, which means it is before it has become obvious cancer. CIN, and it is the skin changes. And we were talking about the daughters of women who've been on diethylstilbestrol. So some cancers in the cervix are glandular in nature. You don't need to know this too much, but you need to know that there are early changes and later changes. And there's a natural history, which sadly, because of unethical practice in New Zealand, where a British pathologist who then went to New Zealand, basically observed these native women when they had proven CIN3 to see how many of them got cancer. So we have got a very unethical study which was then picked up, but you don't want to leave women in this high grade stage 3 situation, because otherwise there will be a proportion who will go on to develop cancer. Not everybody. And so the natural history is, if somebody has mild changes, when I have young women who will say, please, can you cut it out? No, because 80% of young women will find that their CIN1 goes back to being normal in a few years as they clear the HPV themselves. In CIN2, which is the moderate changes, we do individualized treatment. If you're young, haven't had children, we may observe you. We may not necessarily treat you, but if you're 50, we would treat you. If you have CIN3, which is a high grade or severe dyskaryosis, we would usually do a procedure called LETS procedure, where we actually take away this area of the cervix where the virus affects and causes the changes, called transformation zone. I'll show that to you in the next couple of slides, but basically it's an outpatient procedure or under a short anesthetic where we take away this, and it really doesn't affect pregnancy and to a significant effect, but we don't like doing unnecessary treatment unless one needs it. And there is a small failure rate with any of these procedures, but we can reduce cancer risk by 95%. In a small group of women, they will need further treatment, so a repeat LETS procedure or a cone biopsy, which is a deeper biopsy, or very, very rarely, when we have a team discussion, women may benefit from hysterectomy. Hysterectomy is not really the treatment for precancer because the cells are often in the cervix or in the vagina, not in the uterus. But in some women, you may have to do that. So what exactly is cancer? So cancer is where there are DNA mutations and cells basically start growing in an uncontrolled way. And HPV promotes this. That's what human papillomavirus does. And that's what smoking does. And that's what alcohol does. So they all actually are carcinogenic. And so you want to try and get the cancer well before this sort of situation. And it starts in this particular area. That's what makes it so preventable, is because this transformation zone that we talk about is just outside the cervix. It goes higher up in menopausal women, but basically you can see the changes. So this is where the human papillomavirus starts infecting and sitting, because this is where the cells rapidly change. And so we can actually observe it and catch hold of it and treat it if needed. But if you don't treat these cells early enough, these tumor cells can then start spreading into localized tissues, and then can spread far and have higher staging, stage 2, 3, 4, as the stages increase. But basically, these are cells which were there in the pre-cancer cells, which have broken through the membrane and have caused cancer. And that's what you can see over here. You have very normal cells here, and then the abnormal cells are occupying a third, then the moderate changes where there are 2/3, and as you get more severe changes, the abnormal cells with the big nuclei start going to the top, and then once they break through the membrane, that's microinvasion or early cancer. Even here, we can do local treatment. So you really, really want to get it early. You want to get it early so you can actually help people. How common is it? You might say, but I've heard breast cancer is the most common. It is. Breast cancer forms 30% of all cancers, the commonest cancer for women in the UK. And cervical cancer is way down at 14th most cancer, and it's only 2% of all cancer cases. But as I said, remember that it is preventable. And so when you can prevent something, you want to really approach it in a very systematic, scientific way. And so we have about 3,000 new cases every year, about 8 every day, and about 2 deaths every day. So about 3,200 cases every year, and about 850 deaths every year. And remember what I said, that about 50% of women are under the age of 45. In fact, it's the highest incidences between the ages of 30 and 34. But you have about 10% of women presenting for the first time after the age of 75, and they actually do worse. So you want to pick them up early. So you have a patient. Remember the first time I mentioned about the woman who was worried about being on the pill? Now this is another situation. She may say, or tell her friend, I have noticed a bit of bloody discharge, sometimes after sex, sometimes randomly. It's never very much and doesn't happen all the time. I haven't noticed anything unusual. Is this something I should get checked out? The answer is a big yes, okay? Because remember that early cervical cancers usually have no symptoms, but it may be that she has a polyp, she may have a fibroid that's coming out, she may have heavy periods, she could have an overlap with many conditions, but it could also be a symptom of more advanced cervical cancer. So vaginal bleeding after sex, between periods, anytime during and after the menopause, any bloody, watery vaginal discharge, which may be heavy, may have a smell, there may be pelvic pain or pain during sex, although this all these have other causes which are much more common. One shouldn't ignore these. And heavy or irregular periods that's going on for more than 2 or 3 months, you should not ignore it all again, because you can become anemic and you can have lots of other issues as a result. So cervical cancer presents usually late when it has symptoms, and usually with persistent bleeding or bleeding after sex, but it can also present with heavy periods. Most symptoms are after the cancer has spread. And I'm not going to go into too much detail about cervical cancer treatment, but it's a centralized treatment. So anybody who's diagnosed gets managed, because we don't see that many patients anymore. So we want to give women the best treatment. So it is done in London. It's at University College London. And the treatment and prognosis depends upon how long you survive, and what treatment you're offered depends upon what stage of cancer has been picked up. Is it microinvasive? It is stage 1, 2, 3, 4. Is it a high grade? Is it low grade type of cancer? Is it slow growing growth? Is it a big growth? The size of the tumor is important. How old is the patient? What fertility plans does she have? So based on that, the treatment can range from early stages to just what is known as a cone biopsy, which I would do, or they would go on to have a radical hysterectomy, or they may be suitable only for radiotherapy. But usually from stage 2B onwards, we would only be really offering chemotherapy or radiotherapy. So it's really important, again, to understand why we need to pick these cancers up early. And the survival rates are best the earlier it is. 9 out of 10 will survive an early stage at least 1 year, while only 1 in 2 will survive with a late stage diagnosis. And the younger when you're younger, survival rates are best. 90% will survive under 5 years, while only a quarter of women over the age of 80 will survive. And cervical cancer accounts for 1% of all female cancer deaths. So still a very small percentage, but we don't want even that. So Francis, shall I carry on for another 5 minutes?
You've got about another 3 minutes now.
Okay. So the role of lifestyle in cancer is really important. And I think it's important to understand that the top 10 killers are not infectious diseases. They are heart disease and cancer. And in the UK, Alzheimer's disease is the commonest killer for women. And breast cancer is the commonest of all cancers in women. But this is really important to know that not a single one is to do with any major communicable disease like tuberculosis and things. And this is all over the world nowadays as well. So more than half the cases are breast and lung or bowel cancer, and breast cancer is the most common cancer, with the risk of 1 in 7 of us being given a diagnosis, while 1 in 142 women will get a diagnosis of cervical cancer. So you can see breast, lung, bowel, and 2% of the cancers here are cervical cancers. And so it's really important to understand that if lifestyle is related to causing heart disease, Alzheimer's, and cancer, why are we only treating with medication? And this is where lifestyle medicine comes in, where we use not mumbo jumbo, but use of scientific, proven, evidence-based lifestyle approaches. And they work alongside Western medicine. They're not on its own. So, and here, unlike all other allopathic Western medicine, the doctor is in the driving seat. Here you are in the driving seat. Self-care and self-management is key. And the 6 pillars of lifestyle medicine are eating the right food, so eating a whole food plant-based diet, exercising regularly at least 30 minutes a day, sleeping at least 7 to 9 hours, between 7 and 9 hours of good quality sleep, avoiding your screen, stress management, identifying stress factors and finding ways to release those, avoiding smoking and alcohol and risky behavior. We talked about multiple partners and not using protection, and having positive social connection. That means that having a purpose with the social network. So lifestyle medicine works in every single aspect of health, and especially so in women's health. There's no aspect of women's health, whether it's menopause, whether it's dementia, whether it's cancer of the cervix, or whether it is endometriosis or fibroids, there is a role for lifestyle medicine. So a 50-year-old woman is worried as her friend has been diagnosed with breast cancer and she's overweight. Now, obesity causes are complex. They're related to stress, alcohol, but most importantly to diet and a sedentary lifestyle. And being overweight, 74% of the UK population, women, are either overweight and more of them are obese. And that increases the risk of breast, bowel, prostate, and lung as well, and ovarian cancer. And even cervical cancer, women tend to do worse if they're overweight as a result of underdiagnosis and because obesity itself causes a state of inflammation. So there's no cancer. It's, after smoking, obesity is one of the big causes for underlying factors for cancer. Of course, diabetes, high blood pressure, all women's health issues, everything gets much worse, including COVID-19. The highest mortality is if you're carrying more weight and you get COVID. So what can you do to reduce your cancer risk? Whether it's cervical cancer, whether it's breast cancer, you want to try and keep away from alcohol. You only drink it if you for a social occasion. You want to not smoke, and if you do smoke, seek help for quitting. Eat a mostly plant-based diet, regular exercise, and maintain a healthy body weight. And so by a whole food plant-based diet, it means that you want to eat foods that are rich in fiber, because fiber is what will feed the gut bacteria and will reduce your cancer risk. So fruits with no limit, including if you're a diabetic, vegetables, whole grains, lots of beans, peas, lentils, soya, especially in breast cancer and prostate cancer, has a protective effect, and menopause, herbs and spices, nuts and seeds. Try to eat local and avoid salt, oil, and sugar, and use it as flavorings. What foods should you avoid to reduce your risk of cancer? All foods that don't have fiber. So sugar-sweetened beverages, fruit juices, generally all oils, perhaps a little bit of olive oil is okay, refined grains, cakes, biscuits, junk food, ultra-processed foods, and all animal-derived foods. So eggs, meat, dairy, all of them. They do not bring anything to the health. So you've got to ask yourself, why are you eating them? So cancer busters, don't forget, if you want to reduce your risk of cancer, you want to eat a lot of greens, a lot of beans, a lot of onions, mushrooms. A small one button mushroom can help you protect your risk, lower your risk of breast cancer. Berries and seeds. Soya can reduce your risk of both breast and prostate cancer. Flaxseed can reduce your risk of breast cancer. So can 2 cups of green tea every day, and herbs and spices like turmeric. All the same diet that helps you to reduce your risk of breast cancer will help you to reduce your risk of Alzheimer's and heart disease. So cervical cancer is the second most common cancer globally. It's the most common cancer in women under the age of 35. 99.8% of cervical cancers are preventable. It's caused by human papilloma virus. 16 and 18 are the most mischief makers. Most people will clear it in 2 years, but some will not. Practice safer sex, prevent sexually transmitted infections, and insist on your partner also getting tested. Don't smoke, don't start, avoid alcohol, and seek advice if you have any irregular bleeding, postcoital bleeding, postmenopausal bleeding, pain, or if you have concerns. The HPV vaccine is safe and effective, and get the HPV vaccine to reduce the risk of cervical cancer. Complete the vaccine course. You can get it even if you're above the age of 25 or if you've already been sexually active, but stick to your cervical screening protocol on the NHS. Do not miss cervical screening. Precancerous conditions of the cervix can be picked up early and treated. So we do primary HPV testing, then we look at the smear followed by colposcopy. It's easier to treat cervical cancer the earlier it is picked up. Remember to be inclusive, use the right sort of words, and use language-friendly methods so that people feel comfortable. And the future is hopefully self-testing, which is now being trialed with the approval of Stanmore Ethics Committee. So remember the 6 pillars. Remember to eat mostly plants, exercise regularly, including strength training, so that you can avoid osteoporosis. Look after your mind, have a purpose in life, make sure that you have lots of friends, and make sure that you get good sleep. And this is all the discussion we had about the whole food plant-based diet. This is what I would tend to eat most days. Make water your drink of choice. Eat about 10 to 13 portions of fruit and vegetables every single day, which means 1 portion is a handful. So you're basically having a big salad, a big soup, and a few fruits. So we know that when you do that, you will automatically increase the antioxidants and lower your cancer risk. And I can't stop without telling you that the same diet that prevents all those health conditions, a diet where you don't have to worry about putting on weight and you don't have to count calories, is also a diet, because there's no point being healthy on a planet that has been ravaged. So climate change, factory farming, and a diet that reduces animal suffering and also reduces, through factory farming, climate change, as well as pandemics. As you know, COVID pandemic is from jumping of viruses, the avian flu, the swine flu, all these. So remember that for every time you eat a plant-based meal and you're cutting out dairy and meat and eggs and all the animal-derived products, you're actually helping your health. And do it one meal at a time. You don't have to go 100%, but the more you can do that, the more you'll thank yourself. It's the kindest diet for your health and the kindest diet for the planet. And so this is the project that I run. I go to schools and we do lots of yoga, mindfulness. We teach them all about foods, make them taste different foods. We have breakout groups for contraception and sexual health. And so this is my website. This is my social media site at Dr. Nitu Bajekal, Cancer Research UK, Eve Appeal, NHS UK, and Joe Cervical Cancer Trust has lots of information.
Well, I hope you found that both helpful and informative. This is one of a number of videos from the conference. If you want further information or have any questions, then please contact us. The email address will be at the end of the programme. Thank you for watching.